We'll hear from all.
Okay.
I'm sorry. We'll hear from all the panelists, and then we'll have some questions because you raised some interesting points. So,
Okay.
If you could hold on for
Sure,
a
I'll stay.
second. CDCR.
Good afternoon, Millicent Tidwell, the Director of the Division of Rehabilitative Programs for CDCR. Good afternoon, and I know that I wasn't planning on being a part of the panel member, but I wanted to come up and be able to answer any questions that the committee may have about our rehabilitation programs and assure you that we have no intent of relaxing. We are very dedicated to our rehabilitation programs, as you heard from our secretary earlier, and wanted to be able to address some of the issues that were brought up by the Inspector General, if so be it. I know we're having a larger hearing on the programming issues, and you heard some of in the other Joint Committee on Reinvestment, a lot of the program information. So I'm here to answer any questions that you may have or that brought up during the prior presentation.
Okay.
Good afternoon again, Scott Carney for the department. I think it's an important context that one of the key things that's happened in the last 2 years is we've had the discussion in the blueprint and with the courts around what the right population cap would be. And so in the blueprint we had proposed 145% and that we had the ability to meet timely access to quality health care. Over the last 2 years we've had that discussion with the court, and as of this February we have clarity about what capacity number we need to be driving to, and I think that's an important contextual piece. Having that clarity and finality of direction really gives us the ability to move forward in a thoughtful population management approach. So having that clarity and finality of decision is really critical to being able to align our population with the programs that we'll be bringing online. So I think that's a key piece that is new as of this February, and we'll be moving forward with that. In terms of some of the administrative hurdles that were referenced with the OIG's report, I think it's absolutely we have had some challenges, but we've got full commitment from the other partner departments and the administration to move forward. So when we first moved forward on expanding and reestablishing our vocational education programs, we had a concerted and specialized effort to hire all of those teachers, and they had the commitment and support of our partners at the Department of Human Resources. When it comes to doing the procurements for the services that we're trying to put in place, we have the commitment of our partners at the Department of General Services. Still going to do everything that we need to ensure the taxpayers get the best deal for the services that we're bidding for, have fair and open competition, but we've made every effort within the guarantees of ensuring that to move as quickly as possible. And we're taking steps as we look forward to 14-15 to expedite even further, and so we've got that commitment from the other departments. And I think in terms of the number of inmates who are identified in need of program, I think it's fair to say that we've gotten better at completing those assessments and identifying the inmates, but really what we're doing is being more specific about putting the right inmates into the right program, and so that's another key piece rather than just affording or putting inmates into programs that are available at their location. So the specificity of really addressing individuals' needs is of more import, and we're making progress on that.
And just, I'm sorry, sir. And just to add to that point, now that we have the decision from the 3-judge panel, we're able to move people more appropriately to the locations where the services are being offered, and more importantly, bringing up all the reentry hubs and getting those services in place as we speak.
Okay, thank you. Department of Finance.
Yeah, I'd just like to add a point to the concern that the Inspector General raised about the programming that's going to be available at the community correctional facilities and at the Cal Study facility. The governor's budget proposed funding for academic, vocational, and cognitive behavioral treatment at those facilities. Cognitive behavioral treatment includes substance abuse, anger management, family relationships, those types of treatments. So that is proposed to be funded at those facilities as well.
Okay, and the LAO.
Sarah Larson with the LAO. We don't have any further comments on this.
Okay. Any questions?
I forgot to ask earlier regarding mental health beds. You're making some at some other facilities. So how many total mental health beds will be available to in the state?
Department of Finance might be able to speak to this better, but I think it's approximately 390.
390 beds? Okay.
Clint Kelm, Department of Finance. So the crisis beds that you referenced, 390 is the total, but there's various categories in the mental health continuum and different levels of beds. So the crisis beds is a short acute stay, less than 10 days, and there'll be 390 available once CHS fully activated, and the temporary beds that are discussed, the ones at CIM, and there's a few at SAC that are coming down as well.
Okay. Now, one more question, probably regarding the rehab programs. Now, is it safe to say that every facility have different types of programs in place due to the type of the population they have? Because I know when I was back in my tour at CIM, it was kind of a hectic day. It was raining, so I didn't get a full tour of everything, but I didn't really notice any type of programming there. So I don't know if you would know about any services there or elaborate on that.
I actually have it broken down by institution, and I can provide that to the committee after the hearing. And there's over 292 different programs, 17 or so different career technical education. There's academic programs at all of our prisons. Adult basic education, and some college opportunities. We partner with a lot of community colleges around the state. So there is a lot of opportunity, and I can provide that to the committee.
Okay, thank you.
Mr. Stone? Where do I begin? Okay, let's start with the case management system, the logic model. And I don't know what SOMS means, but it sounded like the case management system was something that was working, and for whatever reason we've diverted to something else. I'm kind of interested in both models, and because I also believe you look at the person and holistically kind of come up with a plan for them to get them in. I know the Inspector General brought it up, but it sounds like the department, I don't want to use the word abandoned, but they're doing something different.
And I'll let Millicent address that. It's not that they abandoned it, it's that there was a pilot. The pilot ended, and it's unclear now, maybe not for Ms. Tidwell, but for me, exactly what the intention is going forward. We've had discussions with them about an alternate system under the existing computer system, for lack of a better term, I guess. I mean, there's all kinds of acronyms, and I don't really want to go through all of them with you, but if you want to go ahead and explain what the department's thinking in that regard is.
Yeah, and I apologize if I don't know the exact acronym. Is Strategic Offender Management Systems. It's the SOMS, and I'm learning all the acronyms here at this department. But that is our overall data system that we have for all of our files. It's an electronic file. It's somewhat of a case management system in that all of our information from our central files that used to be hand done is in a new electronic version of this, and we're rolling out the classification and parole programs or prison programs piece of it, where the educational information, the certificates that they gain while they're incarcerated, all of the events that happen while they're in prison will be recorded in this larger management system that we are currently rolling out. And so as far as the case management piece, it was a pilot. There was a very small number of people that were in the pilot, as the Inspector General alluded to, and we saw a 2% variation in the difference between using the case management system and our current system. So that's why the pilot was, I don't want to use your word, but abandoned, not continue to move forward, because we're going to be using this other systems management to be able to have that case management component as part of our ongoing structure instead of having a separate database that's something different. It's rolled up into our larger system. And I'm sorry, I'm not a techie, but I'm sure we could provide you with some further detail on that information.
And in a general sense, I think the concern of the board, the CROB, the Rehabilitation Oversight Board, isn't that you can't have a data system that keeps track of when people have their GED or whether they've gotten a certificate or whatever, but it's that someone can plan ahead on the first day in the door with a counselor and get that set up going forward for all the time that they're going to be incarcerated. Go on a computer, click it in, and say, okay, the next thing you're slated for is VOC training. You finish that. The next thing you're slated for is substance abuse training. We're going to put you there. The next thing and I think I get it. It's not easy. It sounds real easy when we talk about it in concept, but actually putting something like that in place is what we're hopeful will happen eventually.
And yeah, we would echo that sentiment as far as being able to plan out people's activities for their stay, and we're taking this in pieces as far as how we implement it and the modules that we roll out in the larger SOMS implementation.
Yeah, I don't want to create any more acronyms, but just kind of like goal, rehabilitation, and GR. I really, that sounds like something really not only progressive, but it gives each inmate a light at the end of the tunnel. If they follow, stay on the yellow brick road, they'll get to where they need to be. And so I just want to explore that some more, especially as we start talking about rehabilitation and really looking at each individual, I guess is where you're getting at, look at each individual inmate, there is no one size that fits all, and so we have to be a little more robust in how we rehabilitate, and it may be labor intensive, it may cost more, but I think we get, for every dollar we put in, we'll probably get $10 or more back. So definitely we can have more discussion about that.
And I would like to say we're just getting started on rebuilding, these programs. I know it's been a few years since the budget cuts have taken place, but it does take some significant time and effort to rebuild the structure. And the key pieces of rehabilitation that we're looking at are education, employment, and substance use as our three major efforts to get those programs in place, stable, integrated into our culture, and be able to upgrade our rehabilitation efforts from there.
Unless the committee get the wrong idea, I mean, I meet regularly with the administration, and my staff meets regularly with Millicent and her staff, and so probably more regularly than they like, and I think both sides. But we, we don't question at all the intent of either Ms. Tidwell or the department. It's just in seeing the results, and you're dealing with this huge behemoth of an organization and actually getting things started. And so my point was the same as it was to you, that if we every point we delay on this process puts us further down the road to what LAO pointed out and our office has pointed out, which is the long-term gains. So it's a work in progress.
And I'm just saying we have a committee that's probably really wants to invest in that in a robust way. And so I know for the last 12 years, and we always should be prudent with our money, and I know in the last 12 years, I call some of my colleagues, especially the 6-year-olds, people who had 6-year terms as opposed to 12-year terms, they seemed a little bit budget shell-shocked. We freshmen, we've only, as long as we've been elected, we've only had great budgets. So we don't know what it's like not to have a bad one. So I would say take advantage of that.
Yeah.
We're not budget shocked. And so, and especially on this issue, so seriously, I think every member wants to do something more in line with the OIG wants to do to make that a little more robust. And but you have to come to us and tell us, because you're the experts, you have to come to us and tell us what you need and how quickly you can get something done, because sometimes we give you money, but you can't move as fast as you want, because you have to build it, you have to build a facility, you have to staff it, you have to train people to staff them, so some of this won't happen overnight, but we should, as you said, begin this process. And another question is about the fire camps, and since we have no lower level inmates, the reason I bring this up, it was a discussion about, for example, the water bond, and even giving some relief to communities with the water in a drought situation. And we came up with an idea that we probably could give money to the Conservation Corps for brush fires and other things that may occur. And we decided, let's have a discussion about hiring some inmates. And in some arcane rule, it says Conservation Corps may not be able to do that. And so now we're looking at ways we can, legislation or administratively, how we can get around that, because those programs actually do work. I mean, with Conservation Corps, fire camps, they are really good at turning people around and teaching them hard work, getting up in the morning, shining your shoes, putting on the uniform, and punching a clock every day.
And it gives them a lot of self-esteem, I think a lot of self-worth that they otherwise were lacking. And in fact, there were some cases during the recent rains where the inmates that were, they're not working fires currently, that were out in the communities, I know, doing sandbags. So they do other community-based help, if you will, for disaster relief, things like that. Maybe not paid through the Conservation Corps, but certainly in part of their regular duties. I know they do that in the off-seasons. They cut fire paths, they go out and clean parks. They do a lot of things in fire camps other than fight fires. But like I said, the strain right now for the department is finding enough people that are qualified to go there, because you're competing for those same people to run the prisons, because those are the people that are, you know, your landscapers and your maintenance people, and the same people that, you know, qualify to go out of state, and the same people that qualify to go to these MCCFs are the ones that may qualify for the fire camp. So it's a good program. I think that certainly to the degree that we can keep bodies there, it also has a rehabilitative aspect that, you know, these other places don't. But it's a catch-22.
Okay. And I would like for the department or whoever runs that to come back to us maybe with some ideas, some plans, if there's some legislation that needs to be done, but come up with some innovative ideas that we can keep these fire camps going, because like I said, we're hearing some great news out of the rehabilitation world on how their success rate. Okay, and then I guess lastly, this has been an informational hearing. I do want to thank everyone on the panel to be here. CDCR, I guess, need to explain the term 70% of the department's target population and what the raw number is and percentage of the inmates it currently represents. I don't know who that is. Are you Stuckey?
That would be me.
Okay.
Just a little background about that, the 70%, and how the concept was identified in our California Logic model to determine the target population for our rehabilitative programs. That model requires the calculation of an inmate's risk to reoffend, coupled with an assessment of the inmate's criminogenic needs. So that's how we would determine who's included in our target population. So we use the results of the California Static Risk Assessment, CASRA, I have to acronymize everything, that tool to identify the inmate's risk, and then the Correctional Offender Management Profiling Alternative Sanctions, the COMPASS tool, is used to determine the criminogenic needs. So if the CASRA, the risk assessment results, show a high or moderate risk to reoffend, and then the results of the COMPASS show a high or medium need for any of the criminogenic categories, then that's how a person becomes part of our target population, using those two tools. The criminogenic need categories include academic, education, career technical education, substance abuse treatment, criminal thinking, anger management, family relations, and employment needs. All of that covers the gambit. If you want the latest data that was indicated from the last OIG's report, summarized, I don't want to throw a bunch of numbers at you, but about 96% of our total inmate population had received a CASRA risk assessment, and 45% of them had received a core COMPASS assessment. That number has increased in the new report that's coming out next week. Yep, 52.8 or 55% for COMPASS. So we're making incremental progress in expanding that view of our target population. And our target date in our strategic plan identifies June 30th, 2015 as the date to reach that 70% rehabilitative goal, and we are very comfortable that we will be able to meet that goal. So I'd be happy to answer any questions, but that's the basic methodology that we use to define our target population.
And for the committee, not to put too fine a point on it, but I ask my staff to explain things to me a little bit differently because I'm not a numbers person, that's why I went to law school. But, you know, so what what it basically comes down to is you've got the universe of the population of CDCR of about 135,000, let's say. Out of that, you've got about 17,000 we were told today that don't include all these people going elsewhere, fire camps out of state, et cetera. Out of that, you've got the 70% target, which isn't a number necessarily that we've gotten to yet, because everyone hasn't been assessed yet. So we don't know what that final number will be, but right now, based on 55% of the population having COMPASS and 90-something% having their risks assessed, we're at about 54,000 identified target population. So when we measure the department's success at reaching their target population, we're looking at that 54,000 and how close are they to that right now. So that number is going to grow as more people take COMPASS, and I will just tell you, one of the problems was initially COMPASS was voluntary, and a lot of inmates said, I'm not taking it. Well, now it's no longer. So as that number grows, more people get their criminogenic needs assessed. What we've seen a trend is that about 73% of the people now being assessed end up in that target population. So that 54,000 is going to grow. You're going to have a larger target population ultimately left for the department to try to impact before they're released. So again, that's sort of my bigger worldview of everything that she so carefully stated. But it might give you a broader view.
Thank you. Do you think you'll need anything from the department? Will need any legislative approvals or anything, or a lot of this can be done administratively?
What's been already approved by the legislature in the blueprint is the activities that are taking place now. So no, we're administratively carrying out those functions and being able to meet the deadlines that we have set for ourselves.
Okay. And we'll continue, to do our reports on an annual and semi-annual basis, so the legislature will have those on how progress is being made. Like I said, one will be coming out at the end of this month.
Oh, okay.
And I just wanted to add that we intend on using this data to be able to be informed about the services that we need to bring up in the future, additional rehabilitative programs as we move forward.
Great, and thank you. And we'll now have public comment, but I thank this panel for coming today. It's been very informative, and thank you.
Thank you.
And we'll begin public comment. Which side of the...
I'm Helen Roth-Dowden from SEIU Local 1000. We represent the educators and librarians in the department, and we really have seen that there's been a change over there, and appreciate all the work that Ms. Tidwell has done and the new programs that are being brought up. We still had legislation that was passed several years ago, SB 1121, which said that educators would be on the panels that would actually decide what programs that inmates go into, what education programs they go into. That's been implemented in some of the facilities. It hasn't been implemented in all, and I know that seems, you would think there would be an educator on a panel that would be deciding what classes people go into. And it's interesting we had to get a bill passed to actually say that. But we're working with them to make sure that that's something that's implemented in all of the facilities. And I hope we can come back and report to you that that's the case, because we think that we want to make sure, as Mr. Barton said, that we have the right person in the right program at the right time. It doesn't help when you have somebody who has a learning disability or a reading level of 3rd grade and they're put in a 6th grade class, or vice versa, because they're either bringing everybody else down or we're not able to meet their needs. So we're hoping this can be addressed as well. Thank you very much.
Thank you.
Mr. Chairman, members of the committee, I'm Helene Meshar, representing the California Association of Alcohol and Drug Program Executives. We are the statewide association that provides community-based drug treatment and alcohol recovery services, much of which is to the population that comes out of the prison system. We earlier submitted a letter with our recommendations to the entire Budget Committee and also to the Justice Reinvestment Committee. We have a number of recommendations, one of which is has to do with diversion in terms of keeping the prison population down, which is to fund Proposition 36, which would divert people into court supervision and residential treatment for substance use disorders. We also think that the department should expand the current Substance Abuse Services Coordinating Agency, which is the CDCR internal organization that helps place parolees into substance use treatment in communities in post-incarceration. And then we hope that this committee would also work with the Health Committee. We think that the Affordable Care Act offers incredible opportunities for substance use treatment, not only because California opted into the Medicaid expansion, but also last year also opted into the health home provision of the Affordable Care Act. And we think the health home provision offers a vehicle and a framework to focus both coordinated and healthcare services to parolees and to this very vulnerable population. I also wanted to say that our membership is community-based. Many have been operating in communities for 25 and 30 years at the same location. They are well embedded into their communities, and they have the trust of the communities. There are some 18,000 beds that are licensed that could be available through the Medicaid expansion that could be used for residential treatment. And because of federal law, we're unable to access those, and would hope that you would help, along with the Health Committee and the governor, to provide or to convince the federal government to give the state a waiver through the Department of Health Care Services to allow those 18,000 beds to be used for residential substance use treatment. And we're here to help you with the committee, and we have depth and breadth of research, of expertise that we offer to the committee in the coming months as you work on the budget. Thank you.
Thank you.
Good afternoon, Mr. Chair and members. Dawn Kepke with McHugh Kepke & Associates on behalf of Crime Victims United here. Thank you for the opportunity to make a few comments. Just around the governor's proposal overall for kind of dealing with the population management issues as well as the court order. There are a number of provisions and proposals in there that Crime Victims United is supportive of. The expansion of reentry facilities and focused, targeted recidivism reduction programming, education, and substance abuse, mental health services, and so on. Also supportive of the provision that would look at population time served and dealing with longer sentences beyond 10 years. Understand that's not something that would go into effect in terms of moving that population to prison at the outset, but certainly makes sense from a time served perspective. Also are looking at the possibility of being able to support a split sentencing type of approach. That's something that Crime Victims United and the victim community overall has struggled with over the years, frankly. But given the situation around population management and those concerns, as well as the interest of really focusing in on true recidivism reduction, we think that there is perhaps value in that to the extent that we can be honest and really be committed to the mandatory supervision part of it, really holding individuals accountable for whatever particular set of programming that might be warranted in those circumstances, so that we really are making sure that that is having the effect that it's supposed to, which is providing reentry opportunities with supervision, with services, and so on. That said, while we do support a number of the provisions of the governor's budget plan, we do have grave concerns about the policy that would implement elderly parole. We are concerned about that. We are concerned from a victim standpoint that purely just because you hit an age marker, that automatically justifies perhaps what we would argue is early release. We understand there are complications around that, just around the court order and the courts pushing for that. Nonetheless, that is a concern of the victims community. Also, just kind of more broadly, not only Crime Victims United, but two other clients we represent, two sets of clients we represent, the Child Abuse Prevention Center and the adult education community in the K-12 system, the California Council for Adult Education and California Adult Education Administrators Association, really would urge this committee and just the legislature in general, administration as well, to take a more holistic look at, what the drivers of crime and, just what we can do to impact that. Certainly, we understand we have a prison management, in terms of population management issue, and certainly the need to deal with that as well as recidivism reduction. But really there are other things that we could be looking at that are more prevention-oriented, really looking at, strengthening families, avoiding childhood abuse and neglect instances by providing families the tools that they need through local community-based organizations, looking at restoring funding for, those types of programs in the prevention arena. Prevention for child abuse and neglect, they're doing great work in their communities with community-based leaders, but the funding is just not there for, making an impact, and particularly with individuals in the prison system, as well as even local community-based offenders. There is incredibly high instances of child abuse and neglect in those situations. We would also argue that around K-12-based adult education provides some great opportunities and entry points for short-term career training opportunities, basic skills that actually are provided through the K-12 system in both in the communities, K-12 school districts, but also in a number of local jail facilities as well. So really just urge, taking a more holistic view of this, looking at some of those drivers for crime to begin with, in the interest of preventing it, but also avoiding, new victims in the long run, and ultimately hoping to strengthen families so we don't have high recidivism rates. Thank you for your time.
Thank you. Are there any more public comment?
Good afternoon. Thank you very much for the time to be here. My name is Mark Victoria. I'm with AFSCME Local 2620. We represent Bargaining Unit 19 members. Those are psychologists, social workers within CDCR, as well as parole outpatient clinics. Our members currently do provide many of the services that we're talking about here, both in the prisons and outside of the prisons. I apologize for not being as prepared as I should. I will come back with you with more information, but one of the things we definitely want to see is an increase in the funding for a lot of these rehabilitation programs, which we're already providing. Our POC clinics have been severely cut during the budget cycles of past years, and we've lost about half of our members to be able to provide those services. So one of the things we'd like to see is some more funding going into that. There is currently a proposal to double the increase to some of the programs that are providing those services through contractors. We'd love to see some of that coming back to the POCs because we are already currently providing those services in all of the counties across the state. As I said, I'll be following up with each of our offices, and thank you very much.
Thank you.
Good afternoon. I am Rosa Akil with PICO California. PICO California is a faith-based organizing network, and we represent over 450,000 families across the state. And as people of faith, we're profoundly disturbed at the over-reliance of our state to incarcerate folks. And so we're really hoping that this committee will increase smart and strategic investments in two particular areas. The first, we've been talking a lot about recidivism reduction programs that many of the folks here have already alluded to. And second is spending on the Gang Reduction Intervention and Prevention Initiative. It's also known as CalGRIP. And in cities throughout the state, these funds have been used to support implementation of effective programs like Ceasefire, which has been very integral in reducing gun violence. So we're interested not only in reducing recidivism, but in preventing folks from getting entangled in the system to begin with. Thank you.
Thank you. Are there any more public comment? Seeing none, this committee stands adjourned. Do I get to hit the gavel?